Hello everyone. Today I'm going to talk about equine worming, and I've titled the talk Why Tradition is a Thing of the Past, and hopefully as we go through this talk you'll understand why I've called it that. But first of all, a little bit about me. My name's Imogen. I'm one of the medicine specialists based over at the hospital at Breadstone. I have a bit of a horsey background, so this is me probably about 5 years of age, and although I am Australian, I grew up for a little bit of my childhood in the New Forest, and I think it's almost illegal to not have riding lessons when you're a kid growing up in the New Forest. So this is me having my riding lessons in full kit, which apparently was compulsory. I owned horses pretty much from the age of 10 on. This is my dear horse, Joe, who I had for about 20 years. Joe was a lovely horse, not always the best behaved. So here he is deciding that it was time to go for a swim, despite having his saddle on. So this is how we ride horses in Australia. But as I said, I'm Australian, so I was born and grew up for the most part in Sydney, and my veterinary career started in Sydney at the University of Sydney, where I completed my degree. My first job was then in a very large practice, actually quite similar to B&W Equine Hospital in Victoria, which is the state to the south of New South Wales. And we did a huge range of different things, lots of reproduction, lots of surgeries, and a little bit of medicine, which is where I got my taste for internal medicine. For those of you who haven't travelled around Australia, this is the sort of riding that we do. So second from the back there was my boss, Angus, and he has lots of farms up in the hills around the hospital. And as you can see, the terrain is pretty rough. So he ran cattle, and it was our job, not really a hard job, to help him muster the cattle. And so this is where we used to go riding. From then, I moved across to America, and that's where I did my specialty training to become effectively the equivalent of an NHS consultant in internal medicine. It was predominantly horses, so I looked after horses for the most part, but I did about 20% what's called large animals, so quite a lot of cattle, some sheep, some pigs, some goats, the odd camel, and quite a few little alpacas. After that, I moved to the UK, and my first job over here was at the Royal Veterinary College, where I worked as a vet in the equine hospital, teaching students and specialists to be as a sort of clinical teacher. And I actually spent 10 years there before moving 3 years ago to B&W Equine Hospital. And in both of those jobs, I was a hands-on vet. So although I've chopped my head off, I am the person helping to resuscitate the foal that we just delivered via C-section. And also here we are looking after a intensive care neonate. But as I said, about 3 years ago, I moved across to B&W Equine Hospital, and I've continued on as an internal medicine specialist, just horses this time. And for those of you who haven't met me, this is me. So I don't have horses anymore, unfortunately, but what I do have is a dog and a cat. So this is my dog, Shabal, and my cat, Charlie. Charlie absolutely adores Shabal. Shabal pretends he tolerates Charlie, but actually you can see I think they're quite good friends, and they keep me amused. Right, so on to the talk. So just as a summary of what we're going to talk about today, first of all, we're going to go through what worms can infect horses. Next, we're going to discuss why we need to worry about these worms. Then we're going to discuss ways that we can potentially minimise those diseases that are caused by worms. And this is particularly relevant for those of you who are involved in breeding. We need to understand why we can't treat all horses from the day they're born to the day they die the same when it comes to worms. We're then going to talk about two sort of different scenarios. So we're going to talk about worming protocols for young stock, and I've included that up to about 2 years of age, and we'll discuss why we had that cut off. And then again, relevant for those of you who have broodmares, either resident on your farm or visiting, we're going to talk about worming protocols for those broodmares. So I was always taught to learn lists, and then when I was doing my teaching, I was taught that lists are rubbish and you need to sort of understand the concepts. But actually, you do need to understand and learn a few things. So, first of all, what is the list of worms that can affect or infect horses? In the bold type, I've put the names that you are probably familiar with, and in the other type, I've put in the scientific name. So first of all, threadworms. These are the so-called Strongyloides Westerii. Next up are ascarids, or the large roundworms. That's known as Parasites aquarum. Redworms, and these are the large and small strongyles. Then we have pinworms and tapeworms. Tapeworm has an excellent scientific name, but it's very long, so I didn't include it there. And I've put bots and lungworms in. They're relatively unimportant, and I'm not really going to cover them too much here. Lungworms are important if your horses live with donkeys, so if that's the case, certainly discuss that with your vet. So the first thing that we need to know that will help us understand how we can minimise disease caused by worms in horses is actually how a horse becomes infected with worms. So all parasites have what's known as a life cycle, and the horse is an integral part of that life cycle. So there's parts of the life cycle that are in the horse and part of the life cycle that are out of the horse. And to minimise disease, we really need to be able to target pretty much all of those stages as much as we can. Ultimately, the life cycle of each parasite does differ a little bit, parasite to parasite, but there's no need to completely understand every life cycle of every parasite, as long as we have a general idea of how those parasites can infect horses. So it's a little bit chicken or the egg, but I'm going to start with the horse ingesting the immature forms. And those immature forms are called larvae, or in some cases, in some parasites, the horses actually ingest the eggs. So those immature forms can be ingested either through the mare's milk, in the cases of some parasites, or far more commonly through the pasture or the environment. So the immature forms can't really grow into adults on the pasture. They then need to enter the host, so that's our horse. So once the horse has eaten those eggs or larvae, and they don't preferentially eat them, they're just on the grass, so they eat them accidentally, those immature forms then migrate through the intestinal tract, and the life cycle might include other organs, and we'll go through that in a bit more detail later. Those immature forms ultimately end up in the intestine of the horse, where they mature into adult worms. And the adult worms then make eggs, and those eggs then are passed in the feces to recontaminate the environment. The eggs develop into larvae, the larvae are ingested by the horse, and then the cycle continues. So if you just remember, eggs grow into larvae, grow into adults, and then the cycle starts again. So now that we know about what the worms are and how horses might become infected with them, the next thing we need to know is how those worms actually cause disease. And I think the first thing that we need to remember is that horses can tolerate actually relatively large numbers of worms in their body. So it's really only when we have a significant worm burden that we need to be concerned. But our job is to try and make sure that we don't get to that point. So first of all, the migration of those larvae, or the immature forms, through the various tissues in the body sets up inflammation. So they're not meant to be there. The body reacts to try and get rid of them, and that results in inflammation. And that can occur within the liver, it can occur within the lungs, and within the blood vessels. The next thing that can occur, and this is particularly so with the ascarids, so Parasites aquarum, and that's really only a problem in foals, is that the worms can be absolutely massive. So that female worms can be sort of 50 centimetres in length in some instances, and they can physically obstruct the intestines. So if you get large numbers of worms, the food just can't go anywhere because they're all in the intestine. Luckily, that's pretty uncommon. The next way that worms can cause disease is they can damage the intestinal wall. So most life cycles involve the larvae going through the wall of the intestine and into the lumen or the inside of the intestine. So that in itself can cause damage, and some of the parasites, in particular the small red worms, kind of hang out in the intestinal wall. And the intestinal wall is not designed to have all those larvae in there, so that can potentially cause ongoing damage. The adults themselves can be a concern, but it's predominantly the larvae that we tend to worry about. And the damage that is caused by those larvae in particular can result in a decreased ability of the intestine to absorb food, so those horses can lose weight. It can also result in blood vessels becoming leaky because they're inflamed, and that results in protein loss. So the result of protein loss is edema or swelling. So sometimes these animals have big fat legs or swelling or edema underneath their abdomen. And occasionally, obviously, you can get colic. So anything that irritates the intestinal tract can cause abdominal pain. One thing that we are concerned about, certainly at this time of year, is this so-called mass emergence of larvae. And those larvae, as I explained earlier, in some instances can just live in the intestinal wall, and when the time is right, they will exit and mature into adults in huge numbers. And that signal is not completely known, but it tends to occur around springtime, and we presume that means that that the parasites somehow know that if they then grow into adults and the adults produce eggs, the eggs and the larvae that result are much more likely to survive outside the horse compared to the middle of winter, where they're less likely to survive. So we call this condition larval cyathistominosis, and it can be very, very severe with quite nasty diarrhea, weight loss and colic, and ultimately horses can die. So that's one of the biggest concerns that we have when we're trying to organise parasite control programs in horses. So, obviously, we don't want any of those things to happen in our horses, so we want to try and prevent or at least minimise worm-associated illnesses. And the best way to do that, obviously, is to minimise the chance that a horse will become infected with worms. The very, very important part of this whole discussion is that you can't just give a wormer. It's really not that simple anymore. And pasture and environmental management is really going to be the starting point in any parasite control program. And what that means is that if you are removing the feces or the droppings from the environment, then basically the eggs or the larvae that are in there can't develop beyond that stage because you're removing them, and then the horse can't ingest them. So less eggs that are ingested by the horse results in less larvae in the horse, less adults in the horse, and therefore less disease. So it makes complete sense. We need to combine that, however, with what I've termed appropriate treatment in animals with a significant worm burden. So if you remember, we discussed that actually most horses will tolerate quite a large number of worms. We just need to identify which horses have more than the number that they can tolerate. And that's actually a little bit tricky in some instances. Age is very important, and that's why we're going to discuss that at length in the next couple of slides. But we can also measure worm burdens using an egg count. So that's counting the number of eggs in a specific amount of feces. We can also do a blood or saliva test for tapeworms. And there's a new blood test, which we'll talk about a little bit later, that can look for red worms. So we talked right at the beginning about these so-called traditional worming practices. And traditionally, and again, this is not all that long ago, certainly when I went through university, this is what we were taught. So at that time, we were taught that the biggest danger to horses in regards to parasites was the large strongyle, and this is called Strongylus vulgaris. The reason why this was a real baddie was that it actually the larvae migrated through arteries, and those arteries then could become blocked, and it was nearly always the arteries that supply large parts of the intestine, so the blood supply to the intestine would be cut off and the horse would die. So obviously that's not a great thing. In the 1960s, wormers became fairly routinely available to horse owners, and the recommendation at that point was to try and prevent this large strongyle disease. And the best way to do that was to worm them all horses every 8 weeks. So routinely every 8 weeks you gave a wormer. And this did have a major impact on illness and death due to Strongyloides vulgaris, to the extent that actually we almost never see it. In the 1970s and the 1980s, newer wormers came onto the market, and the advice then was to rotate the drugs that you used, so that the horse got maybe 1 or 2 different drugs a year, or perhaps one drug for a year, the next drug for another year, just so that the drugs remained effective. So as I said, we almost never see any problems with this large strongyle, so that's an excellent result. Unfortunately, there has been a massive downside to this really frequent use of wormers. And what's happened is that we've seen a dramatic increase in the resistance of those worms to the worming drugs that we routinely use. And basically, the more you use a wormer, the more likely you are to get resistance. It's a little bit complicated, but if you imagine in a horse, you've got a population of worms, probably 90% of which will be killed by the drug, and 10% of which just have this inherent sort of inbuilt resistance. So if you worm and worm and worm, what you end up with is the predominant population being those resistant worms. So you've actually selected for resistant worms, and then your wormer won't work. And that's what's happening at the moment. And that's really why we're trying to minimize the use of the wormers that we currently have available, so that we can make sure they remain effective. So as I said, resistance to a wormer by definition is the lack of efficacy of a drug that was previously effective against a particular parasite. So you used to give it, let's say 15 years ago, and it killed worm X, but now you gave the same drug and it doesn't kill worm X. So now we've learned about the worms that horses get, the diseases that those worms can cause, and we've discussed why we have to be sensible and cautious about using wormers. So we need to understand a little bit about the wormers that we do have available to us. And they consist essentially of 3 different so-called classes. Now, there are lots of different products that are available on the market, and you might think, well, hang on a tick, if I go to the feed store, there's 14 different types of wormers I can buy, and that may well be the case. So there's 14 different types of boxes, but many of them will contain exactly the same drug. So they all contain ivermectin, which is one of the macrocyclic lactones. So it's important whenever you're designing a worming program to have that understanding that just because the packet looks different doesn't mean the drug is different. Right, so we now need to think about how we design our worming program, and we need to first of all think about different ages of horses, and because we're talking to, I am talking to people who are involved in breeding horses, the whole age matters concept is very relevant. So why does age matter? Well, the good news is that actually horses do a fairly good job of limiting the amount of worms that are in their body as they get older. So they develop immunity to quite a lot of worms as they age. So even if an adult horse ingests eggs of a particular type of parasite, then the body doesn't allow those adult worms to develop. Unfortunately, it's a little bit variable, so it doesn't occur for all worms. But what it does mean is that some worms are only seen in foals, while other worms are seen in all ages. And this obviously becomes relevant when you're trying to design a worming program for foals or for older horses. And I think what you can get at is that there is no one-size-fits-all program for all ages of horses. So it's important that we know this so that our control programs are appropriate. And in general, younger horses, so these are less than 2 years old, because they don't have that immunity, will tend to need more worming on average than older horses. But we don't want to treat if we don't need to. So first of all, we want to discuss what worms do affect these young stock. So we'll go through those worms and then we'll come up with a program where we can try and limit disease caused by these worms. So the first worm, and we mentioned this at the beginning of the presentation, is this Strongyloides Westerii. This is a really interesting parasite in that it can be passed actually from the mare to the foal without needing to be in the environment or on the pasture, because it can be passed directly into milk. So this is the first parasite that a foal might be exposed to, and they can get infected even in a stable. Luckily, it's actually a pretty rare cause of disease. If it does cause disease, sometimes we see foals with just sort of mild scours and maybe a little bit lethargic. We can make the diagnosis of this particular infection by doing an egg count, so looking for the number of eggs in a sample of the droppings. And the suggestion is that you actually have to have quite a lot of eggs, i.e. quite a lot of adults, for that infection to be relevant. So we're talking sort of 2,000 to 5,000 eggs per gram, which is what EPG stands for. And once we get to the end of the talk, we'll talk about what other parasites, sort of eggs per gram, is relevant. And you'll see that you need quite a lot of eggs for us to worry about this particular parasite. Now, if you do have really high egg counts, plus or minus some sign of disease, then you might consider preventative treatment. And that could involve treating the mare in the last month of gestation with an ivermectin, so that's IVM, or potentially you could treat the foal. But for the most part, we don't need to worry about this as long as we manage the environment better. And the good thing is, by about 5 months of age, we don't need to worry about this particular parasite. The next parasite that we want to talk about with young stock is ascarids, or the large round worm, so that's Parasites aquarum. This can be a real problem, and foals can actually pick up really significant worm burdens and therefore get quite nasty disease. Usually you're immune by about a year of age, and that can be a little bit earlier, but we don't need to worry about this particular parasite in adult horses. In comparison to the Strongyloides, these parasites are picked up from the pasture or the environment. And this is really relevant when you're trying to manage your pastures, because young animals shed huge numbers of these eggs, and those eggs then contaminate the environment. They can live for quite a long time, especially in nice warm conditions. And so even if you've overwintered, potentially those eggs might then be picked up by the next year's foal crop. So you really need to think about how you're going to use your pastures best so that young stock each year aren't necessarily exposed to a potentially high burden of eggs. So the eggs are picked up from the pasture and the environment when the foal is grazing. Just like most life cycles, the larvae then develop in the intestine, but they then have a little sort of circuitous route to get back to the intestine. They migrate through the liver, the heart, and the lungs, and then finally end up back in the intestine, and then the large intestine is where the adults mature. So if you think about where the larvae and then where the adults are, we can get diseases associated with predominantly migration through the lungs. So we get respiratory signs, so cough and nasal discharge. And as I mentioned earlier, we can get quite nasty intestinal obstruction if you have large numbers of these ascarids. Strongyles, which we worry about mostly in adult horses, tend not to be a major cause of disease in animals up to 1 year of age, but that's under the proviso that actually you've done a good job managing it with your adult horses. They can certainly cause disease in young animals, so we can't forget about them, but hopefully if you're doing a good job with your adults, your foals won't be severely affected. So if we use all that information, then hopefully we can come up with a logical plan to minimise the likelihood of parasite disease in young stock. And I've broken it up into a couple of different sort of age groups. So, and this is all, of course, under the assumption that you're managing your farm well from the environmental perspective as well. So from 0 to 2 months, so from birth until they're about 2 months of age, the primary parasites that we are concerned about are the Strongyloides and the Ascarids, and you shouldn't need any routine wormers at this time. The next time period is sort of 2 to 6 months, so up to about weaning, and along with the Strongyloides and Ascarids, we can add in strongyles and pinworms, although again, it's mostly the Strongyloides and Ascarids that we worry about. We do a 5-day fenbendazole treatment. That's at about 2 to 3 months of age, so that's the first wormer most foals should receive. And then every 2 months, we repeat just a single dose of fenbendazole up to and at weaning. From weaning to sort of yearling of age, we've lost the concern about Strongyloides because remember, they become immune by about 5 months. So now we predominantly worry about Ascarids, strongyles, pinworms, and starting with some tapeworms. And probably the best drug combination to use for these youngsters are moxidectin and praziquantel. And we would give that in the autumn and again in the spring. The drug lasts about 12 weeks, which is why we don't have to give it very frequently. So autumn and spring is sufficient. And then once we get to the sort of 1 to 2 year old range, the majority of worms that we worry about are the strongyles and the tapeworms. So we will give the moxidectin in spring, then the combination, which treats tapeworm as well in spring and autumn, and then we'll probably add in a summer wormer, just because these horses haven't developed as much immunity to some of these other parasites as perhaps an older horse might develop. So typically that's either an ivermectin or a pyrantel in the summer. You can use fenbendazole to try and target strongyles, but there is quite a lot of resistance. So if you're going to use that, you need to work with your vet to work out whether fenbendazole actually works on your farm or not. And you can do something called a fecal egg count reduction test, which basically involves collecting droppings from a number of different horses that haven't been wormed for a couple of months, doing an egg count on them, then giving them whatever wormer you've decided to give, then repeating the egg count in about 2 weeks' time. And we have set numbers where those egg counts should be below to determine whether the wormer has worked or not. But as I mentioned, you cannot just rely on giving those wormers because you will still end up with big worm burdens or potentially end up with big worm burdens. So cleaning and disinfecting foaling boxes, now that's a no-brainer, should happen anyway, but what it can do is decrease the ingestion of those Strongyloides and Ascarid eggs in particular. As I mentioned earlier, you want to turn out these young foals onto pasture which hasn't been grazed by young stock in the last season. So if you've got a field that has been grazed by pregnant broodmares, that would be ideal. So there is going to need to be some planning involved in this. And the main reason that you don't want those young foals to be grazing on pastures that have been grazed by young stock previously is that those young stock will probably have contaminated the pasture with quite high egg counts. Now, hopefully, if your pasture management and your worming routine is excellent, you will have relatively low egg counts in your foals, but it's best if you can just to avoid pasture contamination and therefore recontamination with foals grazing. It's also important to make sure that you don't forget your adults. So I've just said graze your foals on a pasture that perhaps broodmares have been on for the last season. But you need to make sure that those brood mares haven't shed a huge number of eggs into the pasture. And the eggs that they'll predominantly be shedding are the small strongyles rather. So not necessarily the ones that affect the young foals, but you still want to make sure that you're managing those mares or adult horses as well as you possibly can. And unfortunately, it's very labour intensive and it's really annoying to do, but the best way to minimise pasture contamination is to remove the droppings. You don't have to do it every single day. Twice weekly is sufficient. And basically what that means is the eggs that are passed in the faeces, if you're removing the faeces, then you don't have eggs for the foals to ingest. It is hugely labour intensive. You can't harrow, you can't spread the poo around, you have to remove it. But if you remove it, you are going to do the best possible thing for your foals and your horses as far as minimising pasture contamination and therefore minimising disease caused by parasites. So that's the youngsters. What about the mares? I've mentioned that they are important, and they certainly are. And the good thing about mares is that for the most part, we can treat them and manage them like any other adult horse. There's nothing specific about mares that we really need to worry about. So the two main types of parasites that we need to think about are the small strongyles. So these are the redworms or cyathistomins and tapeworm. And this is where we want to utilise so-called targeted worming. And the reason that we want to utilise targeted worming is that it allows us to minimise the use of wormers whilst maximising horse health. And the interesting thing about adult horses is that actually the worms are not evenly distributed between horses. So let's say we have a field that contains 100 horses. 80% of the worms, so 80% of the total worms in those 100 horses will be in only 20 of those horses. So we need to treat each horse as an individual because probably 80% of horses don't need worming and only 20% do. Now, I understand that this can be quite tricky when you've got large herds and different owners and those sorts of things, but as far as possible, we need to try and identify the horses that need worming and only worm those, because the less wormers we use, the more chance is that they will stay useful and we'll have them in the future. So how do we do that? Well, we need to identify the horses that have a parasite burden. And we can use egg counts, because if you've got adult worms in your intestine, then you are going to be producing eggs and you can identify the eggs in the droppings. And we can also do tapeworm testing. So tapeworm we can't check for in the droppings because it's only very occasionally passed out through the intestine. So we need to do a blood or a saliva test to look for the body's reaction to that tapeworm infection. And then we've got various guidelines that we can use that help us determine whether or not the horse has a significant tapeworm burden. So we need to do that pretty much on each individual horse because we do need to treat them as individuals. But that really needs to be combined with pasture management. So going back to what we just talked about with foals in particular, removing the droppings on a regular basis. So how do we work out a program for our targeted worming? So we want to sort of every season pretty much perform egg counts, so spring, summer and autumn. And this is testing for the adult redworms. It doesn't test for the larvae because the larvae aren't making eggs. So we do need to keep that in mind when we're designing a program. And the cutoff that we tend to utilise is if we identify more than 200 eggs per gram when we look through the microscope at the droppings, then that horse needs treatment. And the treatment will vary a little bit depending on what the horse is normally treated with, what other horses are treated with, but it will involve one of those drugs that we mentioned earlier. We also want to test for tapeworms, and that occurs predominantly in the autumn because tapeworms are picked up throughout the grazing season, and so that's the best time to check where the horse has a significant burden. And as I mentioned, that can be a saliva or a blood test. The good thing about the saliva test is that you don't need a vet to call out to do it. You can do it yourself. You send it off to the company, and the vet reports it and gives you advice as to whether you need worming or not. At the moment, the recommendation is that we treat all horses, regardless of their egg count, in late autumn or early winter. And that's really because we know that the egg count doesn't take into account any of those larvae. And remember, the larvae go on to develop into adults. The adults can make eggs, so they are an important part of the parasite puzzle, but one which we don't necessarily know whether they're there or not. You could argue that if your horse has always had a low egg count, then the likelihood of there being larvae there is pretty low, and that's probably true. But because of the severe disease that can occur with large numbers of larvae, at the moment we do recommend sort of a blanket treatment for all adult horses with a product that contains moxidectin. And moxidectin is unique in that it has the ability to actually kill the larvae in the wall of the intestine. No other product can do that. We used to be able to use a 5-day fenbendazole, and that used to be effective, but it's unfortunately not very effective throughout the UK anymore. So moxidectin is the only drug we have available that can kill those larvae. So you can see why it's really important that we don't overuse that drug. So we still want you to do a tapeworm test in the autumn because we may not need to treat for tapeworm. So if the tapeworm test is low in the autumn winter, then you just treat with moxidectin. If your tapeworm test is high, then you need to add in a drug, and it's usually praziquantel combination, and that will basically kill adult worms, larvae redworms, and the tapeworms. So you've pretty much killed, hopefully, all the worms that are likely to cause significant disease in your adult horse. In the future, we may not even need to do that blanket treatment, and hopefully this will mean that we save moxidectin for when it's really, really needed. So there is a new blood test available now that tests for the presence or absence of small redworms. And it tests, unlike the egg count, it tests both for the larvae, so the immature forms, and the adults. So, for example, you could have a negative egg count but a positive blood test, and that would suggest that you have quite a lot of larvae in your intestine. Now, it's a little bit of a tricky test to interpret, and as vets, we're still learning how to use it most effectively, but it is likely in the future this is something that we will recommend for all horses because we may not actually even need that autumn worming if we've been effective for the rest of the year. So going on now to our visiting mares, and this can be quite problematic because obviously you often have little, if no, control. Now, if they're walk-ons, that's easy. You just don't let them hang out in the fields. But if they're going to spend any time, then you do need to think about how they might contribute to the parasite population. We're not necessarily as concerned with their sort of long-term worming because you probably won't have control about that. But we do need to think about the impact on your farm. So we really want to try and prevent contamination of pastures, especially if they have resistant parasites on their home farm. We really don't want your farm to be contaminated with those if at all possible. So if possible, try and find out a worming history. I know it's easy to say and difficult to do, but that would be ideal. And we want to know when and what with. Next, you want to think about keeping those mares separate or quarantining them from the resident mares and foals. Now, hopefully you're doing that anyway, because that's just good farm management to try and prevent the spread of infectious diseases. You could think about doing an egg count on arrival, and that will give you an idea at least of the adult worm burden. So if they've got 0 egg counts, then actually worrying about your pastures shouldn't be a big deal. In some instances, I know some yards do treat, sort of blanket treat all mares on arrival. Probably not an ideal policy, because we may end up with sort of over-treatment, which is what we're trying to avoid. But if you're going to do that, you might consider not turning out onto pasture for 3 days, because they can continue to shed eggs for a period of time. So you might think you're doing a good thing, you're killing everything, but for 3 days that mare has continued to shed eggs. So, come to the end of the parasite talk. So just to summarise, I'm guessing you were hoping that I would give you an easy answer, but there is no easy answer to parasites and worming. It is not a sort of one-size-fits-all worming program. So there does need to be planning, there does need to be discussion, and that's where your vet can provide really useful information. A worming program will always involve pasture management. Doesn't matter what you do, you will always need to minimise pasture contamination. And hopefully I've been able to persuade you that the old ways are not the best. So really my advice is to ask your vet. It's usually easiest if your vet comes on site, so that they can sort of talk through how your farm works, where you put foals, what you do with your disinfection of foaling boxes, all that sort of stuff, so that they can then hopefully come up with a fairly complete plan. And what should work doesn't always work, so it's really important to continue that communication with your vet to find out if things are working or not.